Hey everybody, it's your girl Nick coming to you again. I just recorded a video talking about my Vivan experience for the first week. And I kind of got off on a tangent talking about my experience with the weight loss balloon Orbera. So I wanted to go ahead and talk to you guys in depth about my experience with the Orbera weight loss balloon. So I have tried many different ways to lose weight over the years. I've tried medications. I've tried Weight Watchers. I've tried Jenny Craig. I've tried watching my calories. And I've just always struggled with my weight since about middle school. So in 2016, I discovered they had this weight loss balloon that was FDA approved. Specifically, the one that I had was Orbera. And what it does, it looks about a breast implant size. It's about this big when it's inflated with saline. They put it into your stomach under endoscopy. They fill it up with saline. You're supposed to have it in for 6 months. And it takes up space so that you only have, a smaller amount of space in your stomach to eat. Therefore, you lose weight. And then after the 6 months, they take it out. So that's what was supposed to happen. Now, what happened with me, one thing that they did not fully warn me on was the nausea. They did mention that nausea was a side effect of this Orbera balloon. However, they did not stress to me the severity of the nausea. I had severe nausea. Now, they give you medication to help you through this. They give you anti-nausea medicine. They give you an antispasmodic for stomach spasms. And there was a third medication, which I can't remember, that they give you as well. These medications did not do anything for the nausea. I was suffering. I had the balloon in on June 27th, 2016, and by that, which is a Monday, and by that Thursday, I was calling the doctor and begging him to remove the balloon because I was suffering. I was not in a good place. I was breaking down crying. I couldn't get comfortable. It was just 24/7 severe nausea, and I couldn't do it anymore. And he tried to convince me, to wait it out through the weekend. He's like, I'm on call, wait it out through the weekend, and decide how you feel Monday. And I was like, no, I can't do it. I tap out. I cannot do this. So I had them take it out. So I had them put it in on Monday, June 27th. And then that Friday, July 1st, first thing in the morning, I had them take it out. Now, let me preface what I'm about to say by this. I have had numerous surgeries. I have had numerous endoscopies. I have had numerous colonoscopies because my father had stage 2 colon cancer at a young age, so I have to have those every 5 years. I have never had a problem with anesthesia. Never. Other than some nausea. But other than that, never had a problem with anesthesia. And so what happened was when I had the balloon out on July 1st, I woke up to my chest hurting because I was coughing so hard. I had a oxygen mask on me. I had the nurses freaking out. Nobody was talking to me. Everybody was talking over my head. I found out later that the oxygen that I had 10 liters of oxygen on me, which for y'all who aren't in the medical community, that is a lot of oxygen. Normally when someone's on it at home, they're on maybe 1 to 2 liters. They had me on 10 liters. I also overheard the nurses say that my oxygen saturations had dropped down to 88. Anything less than 96 is not good. They had me seen by anesthesiology. Again, anesthesiologist came back in. She listened to my lungs. She made a comment to the nurses, because again, nobody was talking to me. She made a comment to the nurses that my lung sounds were diminished, that she couldn't hear my lung sounds that great. They then decided, they were debating back and forth whether or not they should give me a nebulizer treatment to try to open up my airways, or if they should have me walk around the unit. They decided to have me walk around the unit. So they got me up. They had a nurse on either side flanking me, and I was doing laps around the unit to try to get the oxygen moving very well. With all of this stuff that's going on, with having complications on and trouble breathing after waking up from anesthesia, after, the fact that my oxygen saturations had dropped and diminished lung sounds, they sent me home. I was in a ambulatory care setting, same day surgery type of setting, and they sent me home. They never said anything to me about the difficulties I was having from the anesthesiology. Excuse me, I keep saying that, anesthesia. So we drove home, which was about a 40-minute drive, and we got to my house, and my husband parked at the curb of my house. Now, my walkway was not that long. I lived in a townhouse at the time, and my walkway was maybe 30 feet, 25 feet, if that. I got out of the car. I had difficulty breathing, walking from the car to my front door. I had to sit down as soon as I got inside my house to try to catch my breath. Had trouble going up the stairs. Had difficulty trying to catch my breath. Realized, because if you guys don't know, I don't think I've told you, I am a registered nurse, have been for 11 years. So I was recognizing something wasn't right. So I decided I had a albuterol inhaler that I had previously. I didn't have asthma, but what would happen is if I worked out, I would have really bad coughing fits. So I had an albuterol inhaler around. Decided, okay, let me take 2 puffs of my inhaler to try to open up my airways, get the oxygen moving. I couldn't even get the 2 puffs in. I was so out of breath. Constant out of breath, coughing. Really wasn't bringing up anything. Once had a tiny bit of sputum, but wasn't really bringing up anything. Just would have extreme loss of my breath when I would walk. And I couldn't catch my breath, and I was coughing. And, I was texting with one of the physicians that I worked with at the time, and we were going back and forth about what we think was going on. And I said to her at one point, and I said, I think I aspirated when they were doing the procedure. When they were taking the balloon out, I think I aspirated. For you guys who don't know what aspiration is, it's when you have your stomach contents come up, and instead of them going back down to your stomach, they go into your lungs where they're not supposed to be. And that can cause a lot of problems. And so I was thinking that I aspirated. Was still trying to manage it at home. Started feeling a little bit warm as the day went on. So I took my temperature. It was a little elevated, but it was not a fever. So I still took some Tylenol and tried to rest. Couldn't sleep that whole night. I woke up the next morning, which is now Saturday, July 2nd. Woke up about 7 o'clock in the morning, took my temperature again. I now had a fever. It was 101. So I decided, okay, I know I'm having a fever. I'm still not totally too alarmed. I'm a pretty calm person. So I understood that I was still having difficulty breathing. So I was like, okay, I'm going to go to urgent care to get a nebulizer treatment, because maybe that's what I need to help open up my airways, get the lungs working so the oxygen can come in. So it took me literally an hour to get ready to go to urgent care. Now, when I get ready, that's brushing my teeth, using the bathroom, and putting clothes on. It took me literally an hour to get those things done because I was so weak and because I could not breathe. Now, the stupidity on my part is I drove myself to urgent care because I am bullheaded like that. I am a Taurus. I did not wake my husband up. So I got in trouble for doing that. But I went to urgent care, explained to them, look, I had this endoscopy procedure yesterday where they removed the balloon. I think I aspirated. This is what's going on. Can you give me a neb treatment? So they gave me a nebulizer treatment, and the doctor listened to my lungs afterwards and diminished lung sounds. Didn't do anything to it. So she said to me that, you're going to have to go to the ER. Do you have someone that can pick you up? So I had to call my husband, wake him up. He was pretty pissed at me because I drove myself to urgent care. He picked me up. We went to the ER. Arrived at the ER. They did EKG, which showed tachycardia. My heart rate was elevated. They did, I can't remember what my blood pressure was. I think it was a little low. They drew a lot of lab work that showed that I had an infection. And I told them, look, this is what happened. I think I aspirated. So they did a CAT scan of my lungs, which confirmed not only had I aspirated, but I had pneumonia. I had aspiration pneumonia. That in combination with my elevated labs showing that I had an infection, I actually had sepsis. I had an infection in my bloodstream, So now I was being admitted to the hospital. They said, okay, we're going to admit you to the hospital. You're going to be here about 2 to 3 days to treat the pneumonia. I said, okay, I can do that. I'll get my IV antibiotics. I'll get some neb treatments. I'll be good. So I get admitted to the hospital. I get to my room. They have me on a continuous pulse ox to check my oxygen level continuously. Anytime that I moved, that my oxygen dropped and the bells were going off. I couldn't walk now, hospital rooms are not that big. I was in the bed furthest from the bathroom. I literally could not walk from my bed to the bathroom because I was that short of breath. So they had to have a bedside commode right there next to me. Every time I would get up out of bed to use that bedside commode, because it had IV fluids running, my oxygen levels would drop and the bells would go off. Constantly coughing. I did ask them, can I get some cough medicine? So they gave me cough medicine. Next morning comes around, July 3rd, the Sunday. They did morning labs, showed my white count, instead of going down on the IV antibiotics, went up. So then they decided, since my lung sounded so bad and my white count elevated, they were going to do a repeat chest x-ray. They did a repeat chest x-ray, and it showed that my pneumonia was actually worse. So then they wanted to do what's called ABG, a arterial blood gas, and those are very painful. What it involves is they take your wrist, they take a giant needle into your wrist to hit the artery to find out your blood gases, your oxygen, your carbon dioxide levels. And they found out that not only were they abnormal, but my body was compensating to try to get to them to normal. So the decision was made that I was so sick, I now had to get transferred to the intensive care unit. So they moved me to intensive care unit. I was on oxygen. I was on, I believe, 2 liters of oxygen at that time. I was now put on bed rest. I was not allowed out of bed. I'm in ICU. I'm in intensive care unit. I'm getting IV fluids. I'm getting IV antibiotics twice a day. I'm getting steroids through my IV now. And it got to a point where I was allowed to eat up until this point. And I noticed on the little information board, that they have in the hospital, it said NPO. And that means nothing by mouth. You're not allowed to eat or drink anything. So I asked the nurse, I was on a full diet. Why am I NPO? And the nurse proceeds to tell me, well, if we have to intubate somebody, it's best that they don't have anything to eat or drink. So I go off. I'm like, so that's the plan of care. You guys are telling me that I'm so sick. You're waiting for my lungs to fail so that you can put me on a ventilator so I can breathe and rest and still get the oxygen that I need. So I was deathly afraid of going on a ventilator. I had an experience with my father. He was on a ventilator. He never got off. He ended up passing away. So I did not want to go on a ventilator. So I had a come to Jesus moment with myself. And I said, self, you are not going on this ventilator. Because if you go on this ventilator, you ain't waking back up. Get your shit together. So I fought. I fought everything I could to get better. The pulmonologist in the ICU said, okay, well, in the meantime, let's try BiPAP. I said, let's try it. I will try BiPAP if that helps move the air in and out my body. Couldn't tolerate that. My lungs were so full of shit. They were like 3/4 to almost all the way full of crap in both sides of my lungs. Like, that's why I could not breathe. And because of that, when they tried to put the BiPAP on me, as soon as the air would go into my face with the BiPAP, I would lose my breath and I would start freaking out because I couldn't breathe. We tried it a couple times. They even tried to get me out of Ativan to calm me down. I couldn't do it. So then they gave me this little device called Acapella. And what you do is you breathe into it. You breathe in and then you blow. And it helps build up the lung tissue. And it causes vibrations that goes down and try to break up those secretions. So I was doing that every hour. I would set my alarm on my cell phone. Every hour I was doing that. The Incentive Spirometer, I'm sure those of you who have been in the hospital have had surgery. It's the little boxy looking thing with the little tube. You put in your mouth, you take deep breaths, and the little ball goes up and down. I set my alarm on my cell phone, was doing that every hour. So every hour I was doing those treatments, in addition to the neb treatments every 4 hours, in addition to the IV antibiotics and the oxygen I was on and the steroids. It took 3 days for me to finally get out of ICU and bounce back and go back on a regular floor. And I still was on oxygen for quite a while. So I ended up being in the hospital for a week, and I was on oxygen up until that last day when I got out of the hospital on July 8th. Still was, having a lot of problems after that. I had to take a leave of absence from work because I couldn't walk and breathe at the same time. I couldn't talk and breathe at the same time. And the thing that really pissed me off about everything was the fact that they knew something was wrong. When I woke up from the anesthesia, they knew something was wrong. They knew I was not breathing correctly. They knew my lung sounds were diminished. They knew my pulse ox dropped to 88%. They knew that I needed oxygen to bring it back up. But they never, not once, ever said anything directly to me that I had complications or that I should go see somebody. If they had told me, I am an RN, okay? If they had said something to me, because I was kind of out of it when I woke up from anesthesia. I thought I was dreaming all of this and then realized I wasn't dreaming all of this. If they had said to me, look, your oxygen had dropped. We had to put you on oxygen. Your lung sounds are diminished. As soon as they sent me home, I would have told my husband, take me to the ER for evaluation. But they didn't do that. So I had a delay in my care of 24 hours, which allowed me to get really sick. My admitting diagnosis was aspiration pneumonia with sepsis, which is very severe, especially since I'm young. The pulmonologist that I saw in the hospital, he said to me, if you were a couple years older, we would have had a very different outcome. That's how sick I was. So I was pissed. I missed weeks of work. Being able to try to deal with what happened to me and the aftermath of what happened to me sent me into a severe depression, which I had a depressive episode for like a year. Kicked off of that, which then kicked off weight gain, which caused more problems. So in case of any of you guys are wondering, I did talk to a lawyer several times about it because I was pissed that they didn't tell me. And the lawyer ultimately told me that because I bounced back so well, I was back at work. I was in the hospital in the beginning of July. I returned back to full-time duty sometime in September at my job. The lawyer told me that since I bounced back so well and didn't have any after effects physically from it. So, I did the asthma. I now have a diagnosis of asthma. The asthma that I have, my pulmonologist couldn't say it was directly because of the pneumonia. Because I didn't have these long-term effects, the lawyer advised me that I didn't really have a case. So I couldn't punish the hospital system that this happened at. And I wanted to, quite frankly. I was pissed. It's been a year and a half, and I'm still pissed about it. That I could have died. That's how seriously ill I was. I could have died because of this. So I say all that to say this. Definitely do your research before you do something. Make sure you ask questions and detailed questions. So when someone says to you, for example, you're going to have some nausea after this, how severe is the nausea? Because that makes a difference. I always ask, how many procedures have you performed? Because quite frankly, I had blinders on when I decided to go with the Orbera. I did ask how many procedures he had. And that should have been a warning for me, quite frankly, because he told me he had done 8. 8. I'm more about in the hundreds and thousands. But I was so focused on I really wanted to lose weight, and I saw this as a viable option that I dismissed those warning bells that went off in my head. And I'm not saying, let me just say this, I'm not saying that the doctor himself did anything wrong during the procedure. I don't think that's what happened. I think it's just the fact that, they're deflating this balloon. It's not as small as it was when they first put it in because it now has been blown up and deflated. And I think that just the actions of them pulling it out through my stomach and through my mouth agitated my gag reflex. I retched and vomited and then breathed it in because I was under anesthesia. That is a normal post-op or post-anesthesia complication. That can happen anytime that you have anesthesia. That is the reason why you're not allowed to eat or drink anything after midnight when you have anesthesia. It's try to prevent aspiration. So I do not blame the doctor as far as what happened during the procedure. I do fault him though, because I did get a copy of all my hospital records and I read through them, and that's how I realized the things that I thought I was dreaming about, the oxygen dropping and being on the oxygen and hearing the pulmonologist say my lungs were diminished. I thought I was dreaming that. When I read through those post-op notes and the nursing notes, that's when I saw, no, this really did happen to me. And it said in there that the nurses called the doctor because they were concerned about what was going on. And the doctor himself said I was okay to go home. So I do fault him for that. I should not have gone home. They should have took me by ambulance to the ER for further evaluation. So that is my story about what happens with Orbera. There are, I believe, at least one other medical weight loss balloons out there at this point. I'm not sure how many there are now. But that has been my experience with Orbera. It was not a good experience. So please take my story with a grain of salt. And, think about, if that's something you're thinking about, just really think about it. Don't get focused on, well, I can lose this much weight in this short of a time like I did. So please learn from my story. Y'all have a good day. Bye-bye.